Hello, and welcome to this video on how to be successful in home care. I've been doing home care for over 5 years, and here are some tips I've learned on how to be successful as a home care nurse. First of all, make sure you can do all the skills necessary. Whether it's PICC lines, trach, vent, whatever, make sure you have the skills to act independently. Don't think you can wing it. If your agency offers you a case, you need to be honest about your abilities because you have vulnerable people depending on you. On the other hand, you may be surprised. Your agency may be able to train you, and there are some parents who are willing to train under certain circumstances. So keep the conversation open with your employer to let them know that you're willing to learn. Also, when you accept a case, print out the directions to the patient's house and make sure you can find it. I always leave for the meet and greet way earlier than I have to. If I get there too early, I can always find a shopping center to wait in until it gets closer to the time. You want to make a good impression on the family by being on time. Impressions are so huge. The meet and greet is your first opportunity to learn everything about the case from the patient and family. Dress professionally, either in scrubs or business casual. Bring a notebook and pen and a little bottle of hand sanitizer. When you arrive at the house, after you get out of the car, squirt some hand sanitizer on your hands. Rub it in while you're walking up the walk and knocking on the door. The family is probably watching you out of the window, and this will reassure them that you're committed to infection control. Introduce yourself. I'm so-and-so from blah blah agency. Write everything they tell you down in your notebook. Don't rely on memory. You won't remember. Find out where they keep your agency's paperwork, the medication and treatment administration records, and the orders. It's usually called the 485. Find out where do they keep the medicine, supplies, food, diapers. Ask what times they prefer their meals, their incontinent care, bedtime, and get up. And ask if there's any special routines. Ask if there's any allergies in the house. Are there any foods such as peanut butter that you're not allowed to bring into the house for your meal? When you get home, rewrite your notes into the computer. No names because you have to keep HIPAA in mind. The trick I learned to maintaining privacy while keeping notes is to use the first 2 letters of the first name and the first 2 letters of the last name. So, in other words, if your patient is John Smith, you would write it as JOSM. Write out a tentative hourly routine just so you can structure your shift. Start with a checklist of anything you need to do to start your shift, such as vital signs, assessments. Check every piece of equipment to make sure it's working. Make sure you have your feeding formulas, IV fluids, and meds available. Lay out the patient's outfit if necessary. Include everything you would check every hour, such as vent settings and IVs. Include diaper changes and meals. I personally keep a 3-ring binder on every case I do. I put the information I got from my employer in there first, my own printed notes, and I also keep printouts of what I call the patient's 3 Ds, their diseases, drugs, and devices. Don't be afraid to ask questions. Write down the answers. This will make you more independent, and you'll be a more invaluable employee. On your downtime, study. Read over your notes and printouts. You're not going to know everything about your patient after the first shift. You need to read, and you need the hands-on experience. You need them both. After your first shift, add any new information to your notes you've already kept. Think about your shift. Revise your routine as needed. Do some tasks take more time than you thought or less? Alter your routine as needed. Do this after every shift. Keep learning all the time. If you still have your nursing school textbooks, use them. There are a lot of downloadable teaching and assessment tools on the internet. YouTube is a very valuable resource for learning. If you also work in an institutional setting and a new piece of medical equipment is ordered or a new procedure, try to observe it in use. Try to learn how to do it yourself. I know that's easier said than done. Everybody's busy with their own assignments, but if you can, try to squeeze it in. When you learn a new skill, put it on your resume. I personally keep my resume updated all the time on my computer. Home care has the advantage of caring for one patient only, and you can have a very intense learning experience. Use it for the patient's advantage and for yours too. Thank you for watching. I hope this helped. Bye.